Hello, everyone. It's another day with your fertility specialist. On behalf of Alps Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our posts. Thank you for sharing. Thank you for always staying glued to your screen. I'm Ruth Ogogo, one of your hosts, and it's a pleasure to be with you today, Friday. So, we're talking about body augmentation in IVF. So a lot. I before this chat started, someone sent a message to me, and she was like, "This topic is for her."
Okay, that's
so
nice.
so I'm like, I know a lot of people that maybe have had body augmentation surgery, and you're really interested. If you know someone or you suspect someone that might have had it, please call them up right now as we get started. Drop your questions, your thoughts, your opinions in the comment section. And yes, if you are too shy, you can send a message through DM, and we would attend to your questions. We have Dr. Ken with us today to talk about body augmentation and IVF. IVF after body augmentation procedure or after body
Or
augmentation
rather, you
surgery.
mean fertility.
Oh yeah, okay, fertility in general. Well, yes, better put. Okay, so for someone watching for the first time, just a little about Dr. Ken. Dr. Ken is a consultant gynecologist. He's a minimal access surgeon, a fertility specialist, an IVF specialist. And yes, he's the first African to have pioneered laser gynecological surgery in Africa. Wow. So it's good to have you, Dr. Ken.
Yeah, thanks.
Okay, so as we get started, viewers, once again, share this link and call up someone so they are able to get a new information, because this is a rare talk we're talking about today, and this is a talk that a lot of people shy away from, and we deemed it fit to address it so that the populace are well informed and well enlightened of the best way to go about things after body augmentations procedure in relation to fertility as well. So, Dr. Ken,
Mhm.
I'm sure there's also someone that might be watching that might be wondering what body augmentation is all about. So, maybe you should just tell us a little about body augmentation procedures, or what are possible the common ones that people actually do, so people are familiar with what body augmentation surgery is, and then they're able to relate when we are saying body augmentation, body augmentation
Yeah, body augmentation, or what we call plastic or cosmetic surgeries.
surgery.
It's just what it is. It's just plastic surgery.
Mm.
They are surgical procedures, that are undertaken to improve the shape or contour of the body. In which case, we're talking about the muscles, the skin, the
Mm.
fat, in different parts of the body, including
Body.
the breast.
Okay.
So any surgery done to improve the look,
Mm.
and the contour, the look, and the covering of skin over that part of the body usually falls under body augmentation surgery.
Surgeries.
This surgery could be a surgery to reduce some part of the body, or to
Mm.
reduce the sizes of some part of the body, or to take fats away from some part of the body,
Body.
or to transpose the fat, or to inject the fat to some other
Somewhere
part of the
else.
body, or
Mm.
to even insert some inert
Implants.
implants,
Mm.
inert implants to some
Mm.
part of the body, like the breast,
Mm.
the buttocks, and all of that. So
Mm.
these are surgeries that fall in the category of body augmentation as surgeries. So, and it's rampant these days.
Yeah.
And I can tell you the number of people I've seen with body plastic surgeries that are
Surgeries.
coming for fertility treatment.
Mm.
And it's a very important topic that needs to be discussed.
Those days we were very familiar with celebrities doing it, but now even the common man seem to really.
My perspective actually is not
Mm.
necessarily having the celebrities doing body augmentation surgeries.
Yeah.
You know, because the word is called plastic surgery or cosmetic surgery, the populace actually fail to realize that
Yeah.
there is a beautiful health perspective or health improving perspective to body augmentation surgeries.
Surgery.
Looking at it from the psychological point of view,
View.
you know, your look is enhanced, your physique is enhanced, so your confidence and productivity is
Self-esteem.
improved, you
Yeah.
know, and so you have a very good stink to life, you know. Then you have the health benefit. For instance, if a huge uh, a huge mass of fat is taken away from some part of the body
Body.
and probably discarded,
Yeah.
you know, it can improve on health status. For instance, think about those who have insulin insensitivity or insulin resistance, you know, and are bordering on diabetes or are outrightly diabetic,
Yeah.
you know, and you do a weight reduction surgery. I mean, you take out fat, either
Yeah.
call it tummy tuck, liposuction, and
Sanction.
all
Yeah.
of that. You see, you have improved the insulin sensitivity, you have improved their sugar control, you have
Yeah.
improved their
Wow.
blood pressure control, you have you have improved the quality of eggs, because this
Wow.
excess fat reduces the quality of eggs of women, you know, and also has a negative impact even on obstetric care,
Okay.
you know. Excess fat and obesity, you know,
Yes.
makes eggs to be abnormal. You know, I remember doing studies in University of Warwick back in 2013 when I was doing my postgraduate.
Yeah.
You know, fat causes uh, uh, abnormally high number of mitotic spindle in the eggs, and so you have eggs but are abnormal. But this is just because of the fat. You know, so doing body augmentation, for instance, fat reduction, liposuction, and all of that, maybe reducing the size of the arm, size of the thigh, inner thighs,
Yes.
you know, and where else?
Tummy.
The exactly, the
Yeah.
tummy and around the waist does a lot of benefit. So it is not just for the fun of it. Yes, it may have a beauty part of it, but the health part of it for me is even much more important,
Important.
you know. And then I wish there's a better name than cosmetic surgery. I would have called it health enhancing
Surgery.
surgeries. That's what I would have called it.
Wow. So for those people that go about castigating people that go for this plastic surgery, you're getting to know that there are some health benefits associated with some of those surgeries that people do, and it's to better improve the longevity of life in a way, for someone that has health issues. If you're able to, in a way, curtail that, you have increased the lifespan of that person. Well, that's just a bit of it, so more coming. So right now, please call up
And by the way, it's
someone.
not just for women,
Okay.
just that women always take the heat for a lot of negative things in the
Oh
society.
yeah.
The men are as big and obese as women and have the same fat problems like women. So
Yes,
men
true.
could also have liposuctions.
Wow.
They could have tummy tuck.
Okay.
Yeah, they could have
Yeah,
tummy tuck,
that's true.
and the skin reduction following the tummy tuck,
Yeah.
and then because the weight, the fat affect the health of sperms.
Yeah.
So if you do that for a
Imagine.
man, you improve the quality of his sperms. If it is weight reduction, you improve the quality of his sperms. You improve the heart functions, improve the care of hypertension, because weight reduction improves hypertension. Heart problems, all of these will go down.
That.
So it's for anybody who finds himself having weight or fat related health abnormality. So it's not just for women, just that women do more of the
Of
fashion,
that,
and
yes.
all eyes are always on them, and it now
Yeah.
looks like it's just the woman thing. So it's for both
I
gender,
mean, if
the
it,
male and the female gender now, genetics.
yeah, this is me just thinking. I mean, when you see something good, you should appreciate. I can imagine those people, when you see someone really obese and really, really fat, and then you later see this person looking really good. Are you not happy?
Of course.
I mean, there's this joy. You comparing where they are coming from, where
Yeah,
they
to
are
where
now.
they
You're
are
like,
now.
and you're
You
like,
know,
wow. So it's something I think that people should not just go about
some other
castigating.
person may actually be watching now and say, "No, I don't need that. I'll just do exercise." If you're obese, and you have huge mass of fat.
Yeah.
Exercise only would just not improve your physique, because
Mm.
when you have this exercise and you're able to burn down the fat, trim down
Yeah.
the fat, you have
Yeah.
excess skin, and
True.
then you're not happy
That's
exposing
true.
the excess skin.
Yeah.
Still, part of it is you cut off the skin
Mm.
and get it well trimmed to fit the physique beneath, you know, and then you look good. So they go hand in hand with exercise, diet, and the surgical procedures.
Hmm.
So it's just not exercise. Exercise wouldn't just do it perfectly.
Yeah,
You need all.
now that you mentioned, when the person actually talked with me and she was like, this topic today is for her. I was like, oh wow, really?
Uh-huh.
And she was like, she can't kill herself. She was tired of the exercising and
No, it
all,
doesn't work all the
and all
time.
of that.
You need
So
extreme
she had
discipline.
to go.
You need extreme discipline to keep up with exercise, insane
Yeah.
exercise, to,
True.
to get down to the point where you have good weight control.
Yeah. Okay, so viewers, you see that there's just a lot about this that I guess you are not aware of, and then today you are grabbing so much information. So still extend this call to someone so they're able to get as much insight before we get to the fertility part. So are there some specific factors that you fertility specialists would consider when working with clients or patients that have actually undergone body augmentation surgery before?
Yeah, yeah, very important.
Mm.
Over the past few months, I've
Yeah.
seen quite a number of clients
Mm.
who have had some form of body augmentation
Okay.
surgeries,
Mm.
from liposuction to
Mm.
transposition of fat,
Mm.
uh, to injection of fat to some parts of the bodies,
Mm.
to trimming of fat, tummy tucks, and all of that,
Yeah.
and are coming for one form or the other of IVF,
Mm. Wow.
either doing the IVF, doing a fertility treatment to freeze their eggs for the
Mm.
future,
Yeah.
or wanting to go straight forward for IVF. But what worries me is that I have to make the findings myself.
Mm.
A
I
good number
see.
of them don't tell
Wow.
that they
Wow.
have this, and you could mess all of these things up
Oh. Wow.
if you don't uh, inform us of what kind of procedures you've done. You
Yeah.
know, yeah, so you could just mess some of these things up. So it's good, first of all, for anybody who has done this kind of stuff to let the doctor know, I have done so and so,
So
just in
okay.
case
Mm.
there is an
So
intervention
they
that
have to be
that that
open.
that would be given in those places where the tummy where the augmentations are done, you know so they understand, and we avoid those areas and
Yeah.
all of that.
Mm.
I've classically seen ladies
Mm.
with butt enlargement,
Okay. Mm.
yeah, butt enlargement. And sometimes IVF has a lot of injections.
Injections.
So if
Mm.
you have butt enlargement, for instance, and if it is silicone that is used, and then you go taking injection on those silicone, you're going to puncture the silicone,
Hmm.
and then you're going to have a
Wow.
leak of the silicone under the layer where it's inserted,
Hmm.
and then that's a complication.
Wow.
That's a complication. So you need to say it. So if you have that kind of thing, or a fat has been transposed to the buttocks, for instance,
Mm. Yeah.
you mean you should avoid the buttocks for anything.
Wow.
So you may
Okay.
rather go to the thighs and
Mm.
inject to the thighs, or even to
Okay.
the deltoid if the injections are intramuscular.
Yeah.
And of
Wow.
course, you're better off if the medications are aerosol that you just sniff, and then it gives the
Wow.
response. So
Wow.
it's good for such information should be to be given, so
Mm.
that we know how to take good care of
Mm.
you if you have done it, and
Mm.
you are now in a condition or position to undergo a fertility treatment like
Mm.
IVF or
Oh,
something.
okay. Okay, so viewers, I hope you noted that, because a lot of people are not, should I say, yes, most times we see celebrities that actually open up, but the common man, most of the time when they do
Hmm.
it, they would want to conserve that information, they want to hoard it. I
Hmm.
really don't know why they are shy about it. Well,
Hmm.
I mean, if it's something you really wanted, then you shouldn't really be shy
Yeah,
to talk
there's no
about it.
point being shy about it.
About
It's a
it, yes,
beautiful
because
thing to do.
yeah, so it's good that you open up to your physician so they're able to give you the best and not do something that would eventually compromise
Hmm.
your health unknown to them because you really didn't open up.
Exactly. There are some IVF injections, for instance, that are given
Mm.
intramuscular,
Okay.
and the common site for intramuscular for the average doctor or nurses is the buttocks.
Buttocks,
So if
that's
you have
true.
fat transfer to the buttocks, for
Mm.
instance, it means the buttocks has so much fat.
Fat. Wow.
And what we know about fat is this: it prevents or minimizes absorption
Oh.
of
Wow.
of medication.
Hmm. Hmm.
So you inject the medication into this fat, it stays
Yeah.
there and doesn't get anywhere.
Hmm.
So it slows the absorption of those medication, and then it could cause infection.
Wow. Hmm.
Exactly. It will
That's
cause
serious.
infection. So if you give this kind of information, we avoid. Deltoid, hardly anything is kept in the deltoid. You could do it in the deltoid.
Yes. Hmm.
You could do it in the thighs or do it in some other. Actually, you could give injection on any part of the body, so
Okay.
long as you can handle a muscle there.
Hmm.
So you tell us, so your treatment is personalized and distinguished from some other person's own,
Oh.
and
Hmm.
you wouldn't be criticized
With
or
that.
maligned. It's a
Yes.
lifestyle, and I
Hmm.
love that kind of lifestyle.
Wow. So yes, Dr. Ken has said a lot about that. Well, so how does what role does body augmentation play with respect to hormone levels, egg retrieval during IVF? Like, does it have an impact on it for someone maybe that has had a tummy tuck or they've had should I say um tummy tuck, maybe butt enlargement or something? Does it have any impact on their hormone levels, or does it have any impact on the overall IVF process, for instance, in respect to fertility now? Yeah.
Yeah, in the first place, let's establish if facts.
Okay.
It's advisable not to do body talks or body augmentation surgeries until you are done with your fertility life,
Fertility. Hmm.
because you see, pregnancy, for instance, expands almost every part of the body.
Body.
So if
Wow.
you've done it before going in for an IVF
IVF.
or for fertility related treatment, that
Treatment.
you intend to be pregnant
Hmm.
and carry and deliver the baby, then you should get ready for another body
Well, that's
augmentation,
true, because
because you're likely going to have a disruption of your physique.
okay.
Yes,
Wow.
you
Hmm.
could have a disruption of your physics,
Hmm.
because some of those stitches, I mean, some of those areas that have been trimmed could be stretched out again,
Again.
and then you need to
Yeah.
trim it.
Again.
So
Wow.
the
Hmm.
best thing is, first of all, not to do it until you are done with
Which
your
first
childbirth.
birth.
When you're
Hmm.
done with childbirth, you could do it so that it could stay for you permanently,
Hmm.
or for a long time
Time.
before you need some touch-ups on
Again.
it. Okay.
Hmm.
So, but then back to your question.
Yeah.
If you have a talk, for instance,
Yeah.
let's say tummy talk, you have a big tummy full of, and the anterior abdominal wall full of fat, and you have a liposuction with the trimming of the skin and all of that, and you come flat and
Hmm.
probably having some two or three, four packs,
Hmm.
you know.
Impacts.
Okay, almost ladies have one pack, even when they are slim. I've been observing.
Yeah.
My son said, "Daddy, you have six packs." I say, "Really?" I say, "You're kidding. I don't think so." So, when this fat, this layer of fat is
Yeah.
taken out, so you've
Yeah.
done a good deal of great job that enhance a whole lot of your life.
Wow.
Yes,
Hmm.
including the quality of eggs.
Okay. Hmm.
Obesity or overweight,
Yes.
which of course fat is a major part of it,
Yes.
reduces the quality of eggs,
Hmm.
and chances of getting pregnant, and it's
Pregnant.
associated with a lot of uh, 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 undesirable pregnancy outcome.
Outcome.
So when you
Hmm.
do that, you've already improved
Hmm.
on your fertility profile.
Oh, wow.
And then hormones, women hormones, are subject to changes due to fat, the quantity or sizes of fat. So
Hmm.
it improves on the hormone profile of a woman.
Hmm.
And not just the woman, even the man, because
Wow.
the sperms are also responsive to the hormones. When a man has
Yes.
so much fat like that, even the quality of his sperms are also affected.
Oh, wow. Hmm.
The same way it affects the woman. So hormone profiles get improved, even sleep pattern get improved,
Hmm.
then the quality of life get improved, quality of egg get improved, and all of that. So it has a very positive effect on
Wow.
fertility. That's the truth.
Wow,
It has
wow.
a very positive effect on fertility.
Okay, yeah, you already talked about. If I was going to ask for someone that's had a tummy talk and then she's coming to say she wants to get pregnant, but in a way, I think you talked about it that
Yeah.
they should consider.
No, she could get pregnant because different scenarios happen in life. Maybe you do your body talk and you eventually get a guy who is interested in getting having some relationship with you and desire to have kids now come into play. Of course, to hell with body talk, you need to have your babies. And so you're in a good position to have your babies, and then when you're done, you could have another body talk.
Wow.
Oh yeah. Whether it's tummy talk or any talk or body augmentation. Yeah, the same goes with the breast. If you have an augmentation of your breast, maybe with a silicone and all of that, and then you get pregnant, definitely the size of the breast getting enlarged. And then there may be some disproportion when you're done having all of that. So you may need to change the silicone to a more befitting size of silicone.
Wow. This
So
is hard work.
no, it's good work. It's good work. It's just the way you change your clothes. Yeah, you change your shoes, you
Wow.
change your clothes, you change things. So you change that.
So, Adia,
And by
you.
the way, there are good things to do. Naturally,
Yeah.
people don't want to accept that body talks and body augmentation is what they do on regular basis in some form of way, but because it is not invasive, it is not regarded as body talk. When women wear push-up bras, for instance, ask me, how do I know? When they wear push-up bras, what are they saying?
That's true.
I'm doing some talks here, man. You know, they want the breast to be the way it's
More
looking,
firm.
to be more attractive, And so, how about doing it in a permanent way that you don't even need to have the push-up bras? So they're all good. Most ladies want to have big hips. And of course, we know we shouldn't pretend that in some part of the world it's attractive. And so I think these are all good things to do. Yeah, it makes you happy, it makes your guys happy, it gives you confidence, it improves your psyche, improves your productivity,
Yeah.
and makes you look good and admire yourself. It gives you some dopamine. So I guess those who have body talk may live longer than those who do not have.
Well, I
Do
agree
you
with you
agree with
on
me?
that. Oh yes, I do. I do actually because I mean I've seen
No, I'm serious.
some. Now if we were to talk of some of these celebrities that used to be very on the big side, and then by the time they worked on themselves, they look everybody is so happy, like with the way they look,
Exactly.
their lifestyle, everything changes. Their, should I say, their self-esteem is improved,
That's very
productivity
important.
is, self-esteem is one big thing
It's
that
one big
a very
thing.
big thing,
Yeah.
like, so some people that are really chubby, sometimes they try to shy away from it, but the truth is this: if they actually work on themselves, they have more confidence when they slim fit themselves to when they are really on the big side. Even though sometimes they'll say don't body shame me, but no matter how it is.
For the health reasons,
Yeah.
we all know that obesity is not very desirable.
Yes.
So it's
Yes.
not body shaming anyone, and
Yeah.
it's just what it is. When you have hypertension, which is an elderly people's problems
Exactly.
or aging related illness, one of the advices is your diet and your weight.
Wait, that's true.
So talk about body talk here. It does that all in one bit, and you just diet.
So, Adia, do you think there's any risk associated with some of this body augmentation surgery that people do and their fertility, or let's say life in general? Do you think there's any risk associated with it?
I think this is a tricky question. I don't know what you mean. I sincerely don't know what you mean because I'm likely to say there's no risk. Where is the risk, for instance? We're not talking of the surgical procedures, for
Yeah.
instance, but where is the risk? Your weight is reduced, the fat is taken out of your body. I mean, when you're doing tummy talk and all of those things, fat is taken out of your body, and your insulin sensitivity is improved, glucose metabolism is improved, your cholesterol and lipid profile gets improved. And for me, if I'm looking at it in this perspective, I'll say there's no risk.
Yes.
But of course, surgery is risky. When we're going to surgery, those of us who are Christians pray, the Muslims pray, the Hindus pray, even the Buddhists. Everybody prays, to whichever God you're serving to make
Yeah.
this surgery come out successful. So we're all careful about the outcome of surgeries. So if you want to talk of risks in that regard, yes, every surgical intervention may have some risk coming from the anesthesia, from the surgical process itself, from the medications. I have seen an individual before who went in for tummy talk and all of that, but she was on blood thinning medication, and then she didn't disclose to the surgeons that she was on blood thinning medication, even when all questions were asked.
Wow.
So she bled a lot in the process of the surgery, because you melt the fat
Yeah.
with the probe,
Oh my
and then
goodness.
with the heat probe, then you suck out the fat. So she had a lot of seroma bleeding
Oh wow.
because of that. So this is complication. Infection could be complication, and that is why when the excess skin is cut off, you have a girdle. You wear some girdles
Yeah.
to tightly fit the skin over the the gaps created by the suction of the fat, so the skin gets attached and heals properly. So yes, infection could be, but it's the same with every other procedure.
Well, the point I was looking at it is maybe when they don't own up to it, like with regards to when they are having fertility treatment and they don't own up for you to know how to manage them. Maybe just
Oh
like
yeah.
when you talked about injection, what possible risk can they face with it now that they didn't own up to it, and then maybe they are giving them injection when they're not supposed to give injection, risk that they could actually be exposed to, and all of that.
Yeah, so if you give injection in a layer of fat, there's less absorption of the injection, and
Okay.
so the doctors may not get the responses they,
They are
they
expecting.
expect, like growing of
Okay.
eggs and all of that. Then if you give injection over a silicone bag, for instance, in the buttocks, you could
Yeah.
rupture the silicone bag and it leaks gradually, and so you have some disfigurement around that aspect, and then a
Oh.
leak of the silicone. The silicone itself is uh, is an innocent gel. It's inert, it doesn't react to the body, but then it
Okay.
needs to be excavated, it needs to be removed, and you have another one inserted. So
Wow.
you may be predisposing yourself to having another surgical replacement of the silicone, and of course
Wow.
it's not that cheap. So these are some of the things that just maybe responsive, I mean, maybe the risk when you don't tell that you have body
Know that.
augmentation, because we're going to see more of them, because
Yeah.
the world is getting more fashion inclined, more
Yes.
health inclined, more cosmetic inclined, and so we're going to see them definitely. I know sometimes you do these procedures not knowing the future, and then you
Yeah,
now
that's true.
find yourself in a certain future
Yeah.
that things need to change. You need to go back and have it changed. So that's just the way it is. So these are some of the risks that may
Next.
be associated, but I still will maintain that the benefit outweighs the
The
risk.
risk. So, viewers, this is a lot about body augmentation, procedure, and fertility, and then it's a welcome technology that would counsel that it's not out of place, and you shouldn't be shy about it if you've gotten yourself into it already. What's the general counsel now to put with respect to body augmentation and fertility in general? What's your general counsel to our viewers?
Oh well, in the public domain, the information you will find, amongst the big clinics in the world, like
Yeah.
the Mayo clinics and all of that, is that you should get done with your fertility life before augmentation is done. But if you have it done and you still are interested in having kids, making babies, and carrying the babies yourself, and not using some alternative means, then of course you should inform your caregivers of your state, and let them know where they need to avoid. And you should study for yourself to know what you've done and the implication of what you've done with respect to the kind of treatment you intend to access later in life.
Later.
So it helps everybody to handle you the way you deserve to be
Be
handled.
handled. Wow. So viewers, don't be scared of body augmentation. Yes. So this is to let you know that yes, you could have it and you could still try to access some care with respect to your fertility. Just keep it open. But like Dr. Ken has said, the best counsel is still just deal with all fertility things before you consider that. But just in case you are there already, then you still shouldn't be scared. It's been amazing having you, dear viewers, stay glued to your screen with respect to session this
So before
afternoon.
you finish,
Yes.
you know, I've seen a young student before,
Okay.
a young student in Spain,
Okay.
and yeah, with large size of breasts, and when I say large, I really mean very large.
That.
You know, I've seen the way it affects her, and the parents are also affected by the size of that breast because I mean, it got so bad that she can't go to school
Wow.
because she's ashamed of herself.
So,
She feels not good about herself. Yeah, I was talking with the caregiver. I'm like, come on, man, this is a small problem.
exactly.
Go have this thing fixed
Yes, that's true.
and get back the confidence for this
Child.
little girl, little adult,
Yeah.
and and get her back on track. So this is how much pain some people go
Go
through.
through. Yeah.
And then they're refusing to accept. And if you have this size of breast, sometimes it gives you chest pain and
And
backache.
all that. I can imagine.
So why don't you fix it? Just like when you have tummy that is sagging over
Yeah.
everywhere, and you have to wear so many things to tie it together.
And all of that.
It's easy now. You just trim it, and if it has so much fat, take it out. And be healthy again.
Yes.
And health is not just physical thing; it's a
True.
psychological
Yes.
thing.
Very true.
So I guess if I'm that big too, I'm going to have one for myself.
Well, yeah, so this is a lot actually, and it's one thing that really makes people productive is when they have confidence in themselves. And I know that confidence is something that is not just about what you know, even the way you look to also goes a long way to build your confidence.
Exactly.
So you should be able to do anything just to make sure you have that confidence, in any all
And job
ramification.
givers give the jobs to confident people and
People.
people that look
True.
good.
Yeah. Yeah. Very
You may not
true.
like
And
it,
that's
but
why
that
you
is what I've
struggle to look
seen.
good when you're going for an interview.
Exactly.
That's right. That's
You
right.
wear your high
So
heel
this is
shoes so you can be tall.
that's reality actually. And it's something that I think people should really embrace. If you have to, then I think it's something that people should don't be scared of trying. Just hope that everything goes well with you and you don't get into complications. So because we know we've had some people too that went from there, but then it depends. Anything could happen with any procedure. It's not just
Sure.
because it's body augmentation surgery. So
Exactly.
let's not have that fear that it could.
Yes, it's good to talk about this. I don't know how much time our listeners still have to listen.
Okay.
When people go for such activities and something goes wrong,
They
and
just
somebody wants
attribute
to,
it.
they say, "I know."
Mm.
It seems when you want to go for body talk,
Yeah, no,
something bad will
that's
happen.
that's
No,
that's the
nothing bad
notion
happens.
people have.
Bad things happen in a
Yeah,
lot of things. A lot of people
exactly.
have died following cesarean section.
Section.
A lot of
True.
people have died following myomectomy. A lot
Hmm.
of people have died following just anesthesia,
True.
brain
True.
surgeries,
Mm.
bone surgeries, and all
Mm-hmm.
of that. So why do you criminalize body talks?
Even just appendectomy.
Oh, sure, appendectomy.
So it could go wrong with anyone.
People
So
even
it's
die
not because
sleeping
oh yeah.
when nothing is happening.
Yeah, so it could go wrong anytime.
Could
It's
go
not
wrong
because it's
anytime.
body augmentation.
Yeah.
So I think people should not be shy of it. If you have to do it, you could do it and just be healthy and confident. Yes, be healthy. We just want healthy and confident people in our society. So
Uh-huh.
do what you have to do
Good looking
to
people.
oh, viewers. Well, yes, it's been good having this talk with you, Dr. Ken, and I know our viewers had a good time with you today. So, viewers, if you have some concerns, you could still have a private communication just in case you're shy of dropping your question, and we'll definitely attend to them. But we look forward to seeing you same time next time. Have a lovely evening.
Thank
Bye.
you.